Good morning and welcome to Onward in Love and Caregiving. I'm Greg Johnson. I'm the president and CEO of GJP International, Greg Johnson Partnerships. And here in New York, I have the great privilege of serving as the chief advisor to the CEO of EmblemHealth for family caregiving. Now, I want to welcome you from all over the world. And as you can tell, Gene is with us this morning, and he's here in New York. So when we see Gene, we know that we have a special program. He's our wonderful creative director, and it's he who has been behind all of these programs because, my own technology is very, very limited. But we are in our third year of broadcasts. They began in Bali at the villa there where we wanted to be able to talk to one another. And we found that Facebook Live seemed to be that vehicle. And so we've continued with Onward in Love and Caregiving. And I just want to remind you here at the beginning of the program that at any time that you would like to be in contact with me, the email is very simple. It's all small case. It's Greg Johnson at gjp-international.com. I'll say that once again. All small case, Greg Johnson at gjp-international.com. And then also I like to remind you, because we have, as all of you know, we have people from many different parts of the world. So many of you watch us at various times. We go live on Friday morning at 8 o'clock, which it is right now. However, we are seen by many of you at times that are obviously appropriate to your time of day. But we always have the option of going to our YouTube channel where Gene archives these programs for us. Thank you so much. And all you need to do is go to the YouTube link and put in our channel name, which is Family Caregiving with the R-E-V. And you will see Onward in Love and Caregiving and many, many of the other programs that we have done as GJPI and lots of programs that I've had the privilege of doing at EmblemHealth, conversations, interviews. And today we are adding a very special program. Gene, talk to us a little bit about what's happening today.
Well, Greg, it's nice to be back. And so I'm glad that finally I'm able to meet the audience again in a special program with a special guest star. So you know that when I joined the program, because we have a special program with our special guest star that are going to talk about the care management at EmblemHealth, which we both have the privilege to work together for so many years. And so because we also state on our website, Greg Johnson Partnership International, that commerce and caring is always our focus. And this is a great opportunity to explore more about the care management and how EmblemHealth is running that one for so many years. So I think we have some information that we can share to the audience.
That would be wonderful. I think you've got some slides there for us. Yes. There we see a bit of our website, and we see our very famous healthcare stool. The story of healthcare, the three important legs: the care recipient, the health professional, and the family caregiver.
Yes, and please kindly check our website. It's Greg Johnson Partnership International, World Wide Web, gjp-international.com. And you will be able to reach both of us if you need more information about our corporations, including the commerce and caring, healthcare, and also other subjects that may create an interest for you.
And so, also, Gene, also they will find a lot of information regarding our beloved EmblemHealth, and that's wonderful.
That's true. And talking about EmblemHealth, So I will go to the next slide to show this is the introductions to Emblem Healthcare Management. And on the bottom part of this slide, we also put the link where our audience can have more information, more details, descriptions, how to access each points that will be introduced by our special guest this morning.
Wonderful indeed. Thank you so much. And with that slide still standing, it's my privilege to introduce to you, or perhaps we should go to the next slide because it has her lovely photo. Let's do that. There we are. Our guest today is Sara Kaplan-Levenson, AVP Care Management. She has strategic and operational oversight of care management functions across the enterprise because there are many companies that make up EmblemHealth. And prior to joining EmblemHealth, Ms. Kaplan-Levenson served as executive director of the Brooklyn Health Home and led complex care and population health activities for Maimonides Medical Center. Ms. Kaplan-Levenson holds master's degree in public health and social work from Columbia University. And you see her email right there. And so now let's go live. Jean, thank you. And now I'm going to invite Sara to come and join me. Have a seat on the screen. There you are. Hi, Sara. Welcome so much.
Good morning.
Good morning. It's wonderful to see you, and I thank you for being with us today. You're going to be talking this morning to people from many different parts of the world, and many of them are family caregivers. We really began these conversations as I had been asked by the ASEAN Foundation to speak, that's the Association of Southeast Asian Nations, to speak to the different countries about family caregiving. And in the rest of the world, as we well know, we're called carers, but no New Yorker could ever get 2 R's in one word. So we'll remain family caregivers. But we need to know those names so we know what to Google and to get information. But a lot of these people are people who are in the public health sector. They are people who are, like all of us, family caregivers first and foremost. At some point, we do that. But for those of us who are also professional caregivers, our lives become informed by our own journeys in family caregiving. And as you know, and I do, I'm always thrilled when somebody wants to begin telling me their story, because I know that they're going to understand where we're going and what we're looking for so much more. Now, the audience knows that your work and your title in care management is something that I respect and I have adored from the very beginning. Because as you well know, I came to this entire project with degrees as a minister in theater. I had no background in healthcare. And I'm always looking for people to teach me and to have partners. And it became so obvious to me that in order to do the work that I was doing physically, emotionally, and spiritually with members and employees, caregivers, I needed the partnership of the care manager, because you people know, and I'm going to use a phrase that I'm saying with enormous respect, but you know how the game, quote unquote, is played. And none of us as laymen ever go to school to become a caregiver. I often talk about that. One morning you wake up and suddenly you're a family caregiver. Oh, I got to learn. Well, that's not the time to be doing it, but you're into it. And you and I just had an experience this past week with a friend of mine, and I'm so grateful to you and Sara, the rest of your team. I always love it because when people say to me, yes, my insurance is EmblemHealth, I say, thank you, because that means there's care management, there's case management. People who can guide us into the not only the basics, but all the resources that people don't even know are available to them. So let's begin at the beginning. Let's talk to us about care management and case management. We hear both of those terms, so let's clarify. And if there's anything that you think we need to know, tell us. We're sitting at your feet to learn. So, ladies and gentlemen, Sara Kaplan.
Greg, before Sarah starts, so then I will rejoin you later, so because it will give like a better view on your slide. Okay, Greg, Sarah, have fun.
Thank you.
Thank you. And it's such a pleasure to be here with you all this morning. I'm delighted that I could join and share some of my experience and thinking with you around this really important area. As I've said to Greg and say often, I think caregiving is something that touches every single one of us, whether we are healthcare professionals or not, right? That's not a line in which we can distinguish ourselves. If we are not a caregiver right now, today, we were one in the past, or we will be one in the future, and we will eventually need one ourselves. So this is really something that I think resonates with all of us in the professional health professions space and far beyond. So I welcome the opportunity to spend some time with you all this morning. I'm happy to talk a little bit about the distinctions between care management and case management. So case management, I think, is part of care management. Care management, to my mind, is sort of case management plus. So case management is very focused on sort of transactions and logistics and navigating the healthcare system, which of course can be extremely complex. So sometimes that might mean you need support getting access to a particular provider, making sure they're able to accommodate seeing you in a reasonable amount of time. And that can be hard to negotiate on your own, right? So having someone who's sort of working your case, speaking that language that the provider speaks, as Greg said, knowing how to play the game can be really useful in facilitating that kind of access, making sure you or your family member or loved one can get in to see that doctor when they need to. There might be things in your life that are barriers to receiving the care that you need in timely manner, having to do with sort of your social determinants of health. So perhaps you don't have a car to drive to the specialist that you need to see. And maybe there's not a route on public transportation that can get you there, or there is, but your condition makes it very difficult, if not impossible, to utilize that public transportation. Perhaps the public transportation is too expensive. And without working with someone to overcome those barriers, you might forego that care. A case manager can make sure that you get that transportation in place, whether it's actually an ambulette service or something like that, that will pick you up and bring you where you need to go, or some financial assistance or other options that might help mitigate that type of barrier. So a lot of case management is that sort of work around care coordination, making sure all the pieces fall into place. Care management kind of takes it to the next level. So it's looking at a person really in their whole context, their environment, their family, their home, their neighborhood, their ability to really understand what their diagnosis is, what their condition is, how it impacts them, what the course of that illness might reasonably be projected to be, so that they and their support system can make the best decisions moving forward in their care. So if you think back to that three-legged stool that Greg and Jean showed at the beginning, there's the healthcare professional. We know that's a pillar, right? The stool can't stand without them. But they're not there every day, right? The care recipient and the family caregiver are the ones that are there every day. And there's so much going on in life, right? And it's not only the illness or condition you might be dealing with, which of course comes with all sorts of things potentially, right? There might be pain, there might be fatigue, there might be a complicated schedule of medications or other treatments, there might be a special diet, right? All of these things which are overwhelming, not only in terms of your time management, but emotionally. But then there's the whole rest of life, right? It doesn't stop. You might have kids that need to be dropped off at school and picked up from school. You might have a parent that you're also caring for. You might have a job you're still holding down, right? Grocery shopping that needs to be done, bills that need to be paid, laundry, right? None of that stops when we're dealing with an illness or an illness in our family. And so it can be really difficult, I think, sometimes to communicate how that all interacts with that healthcare professional who you might only see once every few months or once a month, right? So a care manager is kind of by your side. They're sort of that connective tissue in between those formal contacts with your doctor or with the hospital. And they can help facilitate that kind of communication. So they might be able to say, you know, let's work together on how to explain to your doctor that this particular medication, it tires you out so much. You're sleeping till 11 a.m. or noon. And that's interfering with other responsibilities that you have in your life. I don't want you to not take the medication, but maybe there's an alternative we can talk to your doctor about. And that can be really helpful because I think a lot of us have that instinct. We want to be a good patient, right? We want to do what our doctor tells us to do. And if we can't do that, which I think is a lot more common than people realize, we're often afraid to tell the doctor. We're often afraid to be, you know, really forthright about what's going on. And sometimes it's because we're embarrassed, or we feel like we're not passing the test. And sometimes it's because we assume that there's no alternative, and there may be. So that's just one example of the kind of interaction that a care manager can help support, because they're going to be checking in on you a lot more frequently than your doctor can. How is it going with the medication? How often do you forget to take it, right? That's a special way of phrasing a question, right? If someone says to you, do you ever forget to take your medication? Your first instinct might be to say, like, no, of course not. I never forget to take my medication. But if you phrase a question like, you know, a lot of people have a hard time taking their medication every day or on time or exactly the way they're supposed to. How often does that happen to you? That starts a very different kind of conversation, right? Sometimes the care manager can even come into your home. They can meet you where you are. There's a whole host of different things they can notice there, right? You know, I notice you've got a lot of these beautiful rugs sort of scattered over your floor. You might not know this, but that's really a hazard that you could trip on. I know, you know, with your illness right now, your balance is a little bit off. It's probably something that never even crossed your mind. Would you like me to help you sort of clear some of these out of the way? I would hate for you to trip and fall. Your doctor's not going to see that, right? And in their brief interaction with you, they're probably not going to ask you about it either. So these are some of the things that I think, on top of all of those logistics, all of that navigation that a case manager would do, a care manager can add. They can really help you understand your own goals, right? What are you hoping to achieve from your care? It might or might not be a total cure from your illness. It might not be a return to 100% of your previous function. But it might be, you know, I'd really like to be able to walk around the block, you know, once in the morning and once in the afternoon, And that's what I want to talk to my doctor about. And then they can help you, even if they're not going to be in the doctor's appointment with you. Let's write down a list of all the things you want to talk to the doctor about. What is the goal of this treatment? How does it align with my personal goals and values and preferences, right? So there's a lot more time and a different focus that a care manager can really spend with an individual's family to support the care that the healthcare professional is providing.
Sara, I just hope that you will take back to all of our wonderful colleagues at Emblem our thanks. As I sat here listening, first of all, I went back to my own experience with my late husband 10 years ago before his passing. And I could see Zita Walker and her team in my heart, and I have often talked of this. Zita's a wonderful care manager at Emblem and a dear friend. But had it not been for that team, I would not have known what to do. I would have been dragging him to the emergency room every 10 minutes because they would say to me, "No, Greg," and then I would tell them what's going on. They would say that's very appropriate, and I would think, but it's not. But it was, and the gift of them was so incredible, and so I fell in love with case management at that time. There's no question, and it is our life stories that inform us as we work with other people. But as I have often said, and I am someone who is an interfaith minister, and so I spend a lot of time not only with Emblem members and the employees, but a lot of other people talking about family caregiving. And every time they're talking, and I connect them with a care manager, I know that I have connected them to an answer to their prayer. Because people, in whatever their tradition may be, are praying for help. And I've had so many people. I mean, it was very interesting. The lady that you and I dealt with earlier last week, she said to me, "Greg, I had no idea this was available. Because she's caring for someone who is the member. She did not know that that was even an option." And as long as I have been with Emblem, it's something that I have talked about, and certainly even with our sales teams and so forth, to say to them, this is a unique differentiator. The power of having a person that can walk with, and I loved that you helped us to understand the case management, the individual, the pieces, but the care management, which also looks at the overall goal. And I thank you. There's so many things you said that I want to thank you, because you spoke to something that we talk a great deal about on this program. We are caregivers. We are not cure givers. And we don't know where the story is supposed to go. That's part of the spirituality of all of our lives. No one gave us the script. We're just asked to live it. And so we care, and we walk with people right where it is, working with, but having a care manager gives us some sort of sense of how better we can implement that which needs to be in the now. Because, I think caregiving is probably the best form of mindfulness I've ever heard of, because it's right now, what must I do? And in some cases, that's good, because too many people in caregiving, they begin planning the funeral. Well, that's a long way off. Let's stay with today. And some days will be better than others. I mean, that I know from my own recoveries. But this is so, so valuable. I want to ask you in that question, what are some things that you would like to say to us as caregivers that we could do to help you, that we could do to be better caregivers, that we could do to be more effective caregivers as part of the overall team of care?
Absolutely. So I think, the number one thing is, as a caregiver, you should consider yourself as important as the patient. I think if you have that attitude, it's going to take you far. It's going to, first of all, help you protect yourself. Caregiving is physically exhausting. It's mentally, emotionally, and spiritually exhausting. And it wears people out. And that's, first of all, not something, that you deserve as an individual, right? You deserve to have all of your needs attended to. You don't want to become a patient on top of a caregiver, right? And that can certainly happen if your needs aren't being attended to. And of course, you won't be able to discharge your duties as a caregiver if you're not well yourself. So it really affects you as an individual, and it affects your loved one that you're taking care of. And that, I really want to emphasize it's the emotional as well as the physical. So it doesn't necessarily mean, your blood pressure is skyrocketed and now you can't do X, Y, or Z, although that might happen. But the emotional wear can really have the same impact. So I think a lot more healthcare professionals are being trained and oriented to really treat the family unit, whatever comprises that unit, as the patient, and not just the individual who is sick. The more you see yourself that way, the more you'll be able to bring the rest of the team along in helping you advocate for yourself and your loved one. So what does that advocacy look like? Again, your emotional well-being. To be able to say, are there any resources that I could take advantage of too while I'm taking care of my partner, my friend, my neighbor, my son? Is there a support group? Is there some place that I could, there's some places that have sort of respite care, right? You can actually have your loved one spend a day or a few days being cared for somewhere else so that you can have a break. And I think not only asking about whether those resources exist, but freeing yourself of some of the guilt that might come along with making such a request. It really allows you to replenish that well that you need to keep giving, right? And that might not just be asking the doctor or care manager or other official member of the team. It might mean asking your sister-in-law or your neighbor, could you pop by for an hour so I can, get my hair cut or take a walk, right? Getting some time and some space for yourself. Again, I think making sure you are communicating with the providers. I'm overwhelmed. I'm exhausted. I don't understand the instructions that you gave us when we were in the office yesterday. So I'm calling back today. I need some clarification. I don't think that appointment time is going to work. Can we reschedule, right? All of those things that, again, I hear this all the time. I didn't want to bother anybody. I didn't want to be a nag. I didn't want to admit that I was confused. But these things are completely normal. And it's actually all of our job as healthcare professionals to make sure that those barriers are addressed and resolved. So that's really the number one thing I would say, making sure that people are giving you the time and attention that you deserve for your questions, for your fears, for your doubts. those are all equally important. And I think there are these strategies, right? I know this happens to me. I've got a little list in my phone, right, for the next time I go see one of my providers, or go with a family member to one of theirs, that so I remember all the questions that I want to ask, because I don't know what it is. When we get in that space, they're kind of rushing and you're kind of rushing, and maybe it's uncomfortable, and maybe you're sitting in a gown and it's freezing, and everything flies out of your mind that you wanted to ask about. So these little sort of tips and tricks, and to even practice in the mirror or with a friend or someone, to say, actually, if you could just give me a few more minutes, I have a couple of questions I wrote down here, if you don't mind, that we could go over them, right? I think some of those things, kind of prepping in advance, can be really helpful. Providers especially, they're busy, they've got lots of patients. It doesn't mean that they don't care. They do, but sometimes they need that little extra push to just slow down, sit in front of you, look you in the eye, and spend those extra few minutes. And that's your right to ask for that.
That is fabulous. I felt like as you were talking, I should say the check is in the mail to you, because these are all the topics that are so important and that we've talked to, but hearing it from your point of view only reinforces it. And it's lovely that you talked about the fact that, yes, write it down. I mean, I have my lists as well, because I may be in the world of it, but when I get in the office, it just is all gone completely. Now, there's one other item that I'm going to ask. I don't even know if we discussed this up front, but it's not going to be a problem, I know, for you. But we have, of course, and I, just as you talk, I mean, I just sit here being so grateful to be part of the EmblemHealth team. I mean, the ability for an organization who people think is an insurance company, but it is a health and wellness company, looking at the holistic picture, looking at a person, physical, emotional, and spiritual, that they would have 22 years ago had the wisdom to say, we need to bring attention to the silent patients. No one's talking about them, and invited me to begin what has been the greatest blessing of my life. I'm so grateful to Emblem, and I'm not saying it as a commercial sort of thing. I'm saying it as a deep sense of gratitude, because I've had the privilege of meeting people like you and so many other people from whom I can learn. And we come to see how it all comes together, because we're all living it as well. That was the thing that interested me from the very beginning. We are our customer. And you said, and it was so wonderful, because it's been my theme with caregiving. Our goal is keeping caregivers, not creating more care recipients. And with your wisdom and your guidance, that can be possible. I can cheer from one end, you can cheer from another end, and together we can walk people into their wholeness and wellness. And I just find that so overwhelmingly exciting. Now, here's the question that I wanted to ask you, because it's one that people are sometimes confused by. And sometimes it can have, and I know you have people that work with you in that, and that is the word palliative care. I would like you to talk to us about those two words, hospice and palliative care. They're words that scare people, and they are words that should be the great gift, that they don't necessarily mean death. It can, but all of us are born to die. We talk about that in our programs all the time. The caregiver, the care recipient, from the day we're born, we're on that journey. I often like Ram Dass, we're walking each other home. I like that, but we've got time while we're doing it to be learning. And so to fear any words, and this comes into case management, because there is medical care where we're looking to do the curing sorts of things, and then we have palliative and hospice. So if you would just give us a brief, I know I didn't ask you about it, but I know it's no problem.
Yeah, that's absolutely fine. I would be delighted to talk about these two things. So, hospice, we'll start there because I think palliative care is a little bit more expansive than hospice care. Hospice care is care that's specifically designed to work with an individual and their family. I think that's really part of the orientation of both hospice and palliative care in the later stages of what's expected to be a terminal illness. Um, in in the United States, hospice eligibility is often defined as, a doctor has predicted that this patient might die within 6 months. So it doesn't mean that they're going to die tomorrow or next week. It doesn't even mean they're going to die within 6 months, right? You can access hospice care 6 months later, still going strong. You can be, recertified to continue to receive that care. And often, and not in all cases, but in many cases, it also means if you're receiving hospice care that you are not receiving care that's aimed at curing your condition, right? So let's say you are dealing with a cancer diagnosis. You are probably not having chemotherapy or radiation that's sort of actively targeting that cancer. You may, in fact, be having those treatments in a palliative manner, right? Because radiation can help manage pain. There are some other reasons that you might take those treatments that are not geared towards curing your disease. But they're still relevant. It doesn't mean that you can't have any other care either, right? You might acquire an infection during that time period. It does not mean you can't take antibiotics to treat that infection. But the focus of the care is not on curing the condition. It's on making sure that you are comfortable, your needs are attended to. That's your physical needs. Your symptoms are managed. You're not in pain. You're not short of breath. All of these, things that can really be challenging in later stages of illness, right? Your emotional needs are attended to, your spiritual needs, your psychological needs, as well as those of your family and loved ones. And hospice care is provided by a team, right? There's doctors, there's nurses, there's social workers. It can be provided in an inpatient setting. Sometimes that's a hospital. Sometimes that's a standalone place that's sort of designed to look and feel more like a home. Sometimes it's in your own home. And again, in the United States, I think one of the unfortunate results of that fear that Greg was talking about is that people don't take advantage of their hospice care benefit until they're very, very close to the end of life. So most people who end up receiving hospice care, if they receive it at all, might receive it for a matter of days or weeks when they could have received it for months. And in fact, there's some data that shows that people on hospice care actually live longer than those who are not, because the stress of some of the treatments can be so severe, and the sort of emotional consequences of not having your whole person attended to can actually shorten a person's life. When you ask people, where do they prefer to die? Most people do not say they prefer to die in an ICU, hooked up to all sorts of machines, maybe not aware of what's going on around them, not able to say goodbyes to their loved ones. But that actually is where most people die, right? So we know that there's a disconnect. So what is palliative care? Palliative care brings those principles of hospice closer, earlier in the course of an illness, right? So there's no definition around, would I be surprised if this patient died within the next 6 months? The criteria, so to speak, is sort of, is this someone who's dealing with a life-limiting or life-threatening illness. Neither of those things means you're going to die, but it means you have a serious illness. And therefore, it's appropriate to have care, perhaps simultaneous, right alongside care that's, aimed to cure or mitigate in some way your disease or prognosis, but care that's really solely focused on making sure your symptoms are managed. Your physical symptoms, your symptoms of anxiety, your symptoms of depression, your symptoms of spiritual stress. Making sure you're having those conversations around what are your goals of care? What do you hope your treatment will achieve? What matters to you? If you stopped being able to function in X, Y, or Z way, how would we want to proceed from there? Kind of helping people formulate those decisions, those preferences, those values and judgments when they still can, right?
Yeah.
And to do that as a family, so that you can also have those conversations with your doctor, right? Lots of people, as we were saying earlier, they say, I don't want to go back into the hospital. But then when they appear to be, gasping for breath at 2 o'clock in the morning, if you're not prepared for that, you haven't talked about that, your family's not on board with what that means and what that looks like and what to do, chances are good you're in an ambulance going back to the emergency room. And that's not what you wanted. So palliative care really helps think through all of those things, align the team around what your goals really are, aligns the family, right? And you can often sort of execute official documents around who will be a decision maker on my behalf if the time comes that I can't make these decisions. You can make that person's job a lot easier by making some of those decisions collaboratively with them ahead of time, right? And so everyone who's providing palliative care is really an expert in guiding those conversations and guiding a person and a family's thinking around how to cope with a serious illness.
That has been so wonderful. We in this program, as I often say, none of us is getting out of here alive. So let's talk about these things. Let's take the fear out of it. Let's face it and live, face it and recover. And when I say recover, it doesn't mean get perfectly well. It means have a quality of life that is appropriate to that which you and the patient wants to deal with. But no one gets anywhere by denial.
Exactly.
You don't get anywhere with that. And we are an international program. So, I also, as you know, live in Bali, and the conversations of death and dying, the curtain is very, very fluid over there. It's a totally different situation. And I often want to bring that loving kindness back here into the American conversation and allow people to talk about these things. It's not just a numbers game. It's not the quantity, it's the quality, and many of the things we've been through. But I think it's a beginning part is, and this is where I'm so grateful to Emblem and the entire team, because I know we have people who are developing more in the palliative care world. People don't know this, sadly enough, and I keep talking about it because each of these pieces in healthcare are very important, I think, in making decisions of to whom am I going to give me?
Yes.
What company do I need? But if we don't know the whole story, and that's why I am deeply, deeply grateful to have you with us this morning. I could go on and on because you're being called, I'm sure, for another meeting. But we thank you. Before we end, I'm going to ask Jean, can you come and join us? I see him arriving. There you are. Thank you very much for opening our program and for being here and creating all of the technology. I refer to him as our creative director because he's so good at, he said, sit here, do this, and yes, boss.
Well, I'm grateful grateful for Sarah, and I'm grateful that I have like the easier task to do compared to Sarah. I mean, Sarah, thank you. I cannot say more how I admire what you're doing. I mean, you are dealing with like that sickness, illness, depression, and you still be a kind of person that can share the happiness in your life, which that is the kind of the attitude that we need to show to all of the caregivers and also to care managers. I like when you say that everyone needs to set their own goals because every case is special, every person is special, and we need to convince all of the caregivers and the care managers that you are running the most difficult, but at the same time, the most rewarding jobs. I think that's it's just like the key message that we're going to deliver to all of our audience all over the world, Greg.
Absolutely, Gene. You couldn't have said it more beautifully, but you do know how to do that sort of thing. And I just want to thank Emblem, and I want to thank Emblem for allowing us to have you in this program today. I look forward to interviewing more of our colleagues because I think it's one way that we can make a contribution to our caregivers to understand what is all out there and to help them make informed decisions, to be informed consumers, literally. So I thank you so much. I thank you, Gene. And now I'm going to say to our wonderful audience, wherever you may be, right below, once this is posted, we're going to have that slide and the link to the EmblemHealth site. But in the meantime, let us all remember, it is onward in love and caregiving. Namaste. Blessings to you all. Thank you, Sarah.
Thank you. My pleasure.
Bye-bye.